America's ongoing school nurses shortage turns dire. I don't know what the school year is going to bring. I don't know what the school year is going to bring, she said. With the highly transmissible Delta coronavirus variant circulating in the United States and tensions boiling over around masks and vaccine requirements, this school year will be like none she has experienced before. For the past 7 years, Prey cared for young students across 4 different elementary school buildings within Moses Lake School District in central Washington state. Now, she will care for older students at Moses Lake High School, more than 2,000 students total. It's so fun to see those students coming back to me, and seeing how much they've changed over the last few years, and the young adults that they're molding into, Prey said. I'm excited to see them all at the same time, but I'll admit I'm nervous. Prey is one of about 96,000 full-time school nurses in the United States who are facing an uncertain school year ahead. Even before the pandemic expanded their workloads and altered their day-to-day tasks, the United States was grappling with a shortage of school nurses. By the end of her first day back, Prey had taken on a stack of paperwork an inch thick, found time for a single restroom break, and managed a late lunch around 3:15 p.m. Pandemic sheds new light on old problem. Pandemic aside, the U.S. Centers for Disease Control and Prevention recommends that schools have 1 full-time nurse for every 750 students. Now, when students and schools may need nurses more than ever, it's estimated that about a quarter of schools still have no nurse at all. The latest data from a national school nurse workforce study, published in the Journal of School Nursing in 2018, found approximately 39% of schools employ full-time nurses and about 35% employ part-time school nurses, while 25% do not employ school nurses. In Washington, where Prey is based, a working paper from the University of Washington's Center for Education Data and Research in Seattle found last year that the statewide student-to-nurse ratio during the 2019 to 2020 school year was 1 nurse for every 1173 students on average. The country has had a shortage of school nurses for years, but the burden is clear now. I would love to see a school nurse in every school across our country, said Linda Mendonca, president of the National Association of School Nurses. That would be my magic wand dream, because every American schoolchild deserves a school with a full-time school nurse, not just to help them navigate through a pandemic, but to support students every day with their physical and mental health and making sure that they are academically ready to learn, Mendonca said. When I moved to the high school this year, not only did my caseload almost triple making that move, because I'm the only nurse in the high school, but we haven't seen a good majority of those kids in the building for 18 months, said Prey, who also serves as president of the School Nurse Organization of Washington. So, we're dealing with all of their chronic health conditions like diabetes, asthma, allergies, and then on top of that, toss in all of the mental health pieces. The anxiety about walking in the door that first time. Depression because they've been at home without any socialization with their peers, Prey said. And then you've got COVID. You can definitely tell there's a lot of tension due to the pandemic. Prey has other responsibilities now added to her plate, planning COVID-19 testing strategies and pop-up vaccine clinics, analyzing ways to disinfect surfaces and improve air ventilation, preparing for potential COVID-19 outbreaks, and disgruntled parents who may be against masks or vaccines. In our district, there was a protest down at our administrative office about the mask mandate, Prey said. You can definitely tell there's a lot of tension in our state right now, regarding masks and vaccines. That tension also has been seen nationally. During a school mask meeting in Florida, scuffles broke out. Outside of a school board meeting in Tennessee, angry anti-mask protesters harassed a parent. In Louisiana, protesters forced the shutdown of a school board meeting after not complying with a statewide mask mandate. The division over masks and vaccine requirements within communities tend to reflect the variability among U.S. school districts when it comes to rules and policies. Nationwide, Some schools mandate that students and staff wear masks to reduce the spread of the virus that causes COVID-19. Others don't. Some schools require anyone exposed to the coronavirus to quarantine to reduce the risk of spreading the pathogen to others if they are infected. Others don't. Some schools require staff to be fully vaccinated against COVID-19 in order to protect young students who are not yet eligible to be vaccinated. Others don't. Because COVID-19 policies vary across school districts, the responsibilities of the school nurse can vary as well. And in some schools where mitigation measures to reduce spread of the coronavirus are not followed or enforced, that can increase a school nurse's risk of exposure to the virus. Rural schools more likely to have no nurse. Some of these differences in school policies, practices and behaviors can vary by geographic region. Schools in the rural regions of the United States appear to be significantly more likely than schools in urban areas to report having no nurse at all, according to the study published in the Journal of School Nursing in 2018. In that study, 23.5% of rural schools report having no nurse compared with 10.3% of urban schools. Funding is a key issue. There is an inconsistent mishmash of state and local funding that puts small rural school districts with inadequate tax bases at a disadvantage, she said in the email. And those areas also are likely to have a shortage of primary care pediatric healthcare providers as well. In those schools where no nurse is on staff, often teachers are trained and relied on to provide certain aspects of medical care that typically would be performed by a school nurse. In Illinois, the Chicago Teachers Union went on strike in 2019 while calling for a full-time nurse in every school. Chicago Public Schools, according to its website, is still hiring nurses to meet that goal. Even before the strike in Chicago, the American Academy of Pediatrics in 2016 recommended that pediatricians can advocate for a minimum of one full-time professional school nurse in every school. School nursing jobs can be hard to fill, but there appear to be several factors driving the nation's school nursing shortage specifically, including the funding needed to hire, no direct pipeline to connect nurses to schools, and lower wages compared with other nursing roles in hospitals or other settings.
Thank you for watching. Please subscribe.